I think I intended into this world knowing I was going to be a veterinarian. Even as a child, I played with stuffed animals. I never played with dolls. And so I was very fortunate. I got to go to the University of Florida College of Veterinary Medicine. And after graduation, I've now been in practice. I'm rounding close to 40 years in practice. I've done emergency work. I am also a paramedic. That's how I did my undergraduate work. I just love emergency medicine, but I've been doing that just in the veterinary field. So 40 years in practice and 38 of them in the same location. My twist in practice came about 20 plus years ago when one of my horses had a riding accident with my youngest daughter in the arena. And what happened was the horse had a spasm. She reared in the air. My daughter didn't know to let go of the reins. And so she was literally dangling from the reins on this horse's mouth, trying not to fall off, and inadvertently was going to pull the horse over backwards. And that could have been a fatal accident because a 1,400-pound horse physically landing on a 50-pound child would have been a disaster. But somehow this horse knew where that child was falling. And as she was being pulled over, she consciously pushed herself as hard as she could in the opposite direction. When she hit the ground, I could not see space between my child and the horse. When she did catch her breath and get back onto her feet, my daughter was still laying on the ground, not moving. So by the time I jumped over the railing and I ran over to my daughter, not knowing what I was going to find, thank God, the only thing my daughter hurt was her pride. But that wasn't the end of the story. What ended up happening is back home at our training barn, she had several more incidences where this spasm was happening. And I had equine veterinarians come out and look at her, and they said, Dr. Siegel, I don't know what to tell you. We don't know what's wrong with her, but here's the two things we can tell you. One, she's not ever going to be safe to ride again. She'll never be shown again. And here are your two choices. You can put her out to a pasture and retire her, or you can put her down. And it was those words, John, that really launched me into a whole new paradigm shift, because that horse had saved my daughter's life. And there was nothing that was going to stop me from healing this horse. And that was really started my journey into integrated medicine, because I was going to find an answer. And I just knew in my heart that just because they didn't have it didn't mean it didn't exist. It just meant they didn't know any better. And that's what I've been doing ever since, is finding more and more modalities to be able to integrate into practice. And as I treated her, I ended up bringing that into my practice. And so now I have probably the most integrated veterinary practice in the entire world with the technologies that we have, because in my heart, I felt like if there was something out there that was going to help, I was going to use it. And so I've never let price dissuade me on buying equipment. I have some pieces of equipment that are over $40,000 in a veterinary practice. My x-ray machine is $150,000. And I said, I don't care. I need the best. I need to be able to do what I need to do, and I want the outcomes. And so I'm very fortunate that we have outcomes that most people don't get to achieve.